Hi, Health Shenanigans family. Welcome back to another episode of Health Shenanigans. Makuwa eotano amahunga hunga ngezempila kahle. Today you're coming into a very interesting episode. But before we get into that, I just want to welcome back our returning subscribers. Thank you so much for supporting us. Thank you for sharing our videos. I see our subscribers are increasing every day, and we appreciate you. To the new subscribers, maybe you're still hesitant, like, Betaneshe a podcast. It's a very interesting podcast where we talk public health, real stories, real issues, and we'll be very excited if you subscribe, like, and share. You'll find us on Twitter, you find us on Instagram, you find us on TikTok, LinkedIn, we're everywhere. So please follow our pages, and we really, really appreciate that. So today we are getting into quite a sensitive topic, but also a very important one that I feel it does get a lot of attention, but we're talking adolescents living with HIV, and we have Netsai Mafararikwa and we've got Dr Marume, and I'm going to give them a chance to introduce themselves. You can go ahead, Netsai.
Hello everyone, I'm Netsai Mafararikwa. I am a motivated and hardworking student who is more interested in the health sector, particularly in pharmacy.
Nice, that's right.
So my journey didn't just begin here.
Mm-hmm.
It started way back in 2016,
yes,
where I did my dispensary assistant
yes,
at the University of Zimbabwe, but it was from Dr Marume and the Dr Mtibende
okay.
program.
All right.
So I decided to further my studies, and HIPH has welcomed me very well.
Nice.
They given me an opportunity to further my studies.
Nice.
So I'm deeply grateful for this opportunity. Through hands-on training, expert guidance.
Yes.
I'm a focused student and a hardworking person.
No, we can see that by your research. Like, we're gonna get into that. By your research, Kai, you did so well, Netsai, and I'm going to give you time to talk about it. So our viewers, like, you guys need to just keep listening, because you're going to hear quite an interesting research that Netsai did. She did amazing, and we're so proud of you, by the way. So thank you so much for introducing yourself to our guests. Doc?
Thank you so much for hosting me today.
Yes.
It's such a pleasure to be part of this podcast.
The Shenanigans family.
Yes, thank you so much. So I'm
Yes.
Dr. Paddington Marume. I'm a medical officer at Newlands Clinic, where we look after people living with HIV, including adolescents,
Yes.
middle-aged, and geriatrics. So I'm also here to share a bit of my experience
Okay.
in terms of the field.
We're so happy to have you, Dr. Marume. You're doing Basaraka Kosha, so thank you so much for that. Then we've got my co-host, Ms B. I'm sure you've seen her on one of the episodes, and I'm so happy to have her here. She can introduce herself.
Okay. Hello everyone, this is Miss B. People call me
Miss B.
Yes, Blessing Musora.
Yes.
I'm looking forward to be working with each and everyone and hear what they have to say today.
Awesome. I'm so happy to have you here with me.
Thank you.
All right. So Netsai's research is titled An Assessment of the Health-Related Quality of Life Amongst Adolescents Living with HIV and AIDS and its Effect on Medication Effectiveness. Guys, this is some big stuff.
Yes.
Okay, so stay with us, because this is a conversation that goes beyond medicine and it goes into the heart. So Netsai, can you just give us a brief overview about your research in terms that anagogo, anambuya, natete can understand?
Okay, my research was a focus to the adolescents, age groups between 12 and 19.
Okay.
So I had about 82 respondents from 3 clinics.
Okay.
It was urban and peri-urban.
All
clinics.
right. Okay.
So I assessed their physical health, their psychological well-being, their medication adherence, and their social wellness.
Okay.
So I found that despite being physically well, their psychological well-being and social wellness had low. It was low.
Okay.
Yes, it was average. It was low. So there was a strong relationship, a strong positive relationship between medication adherence and social
social well-being.
Social well-being.
Okay.
Yes.
All right.
Yes.
Okay.
You wanna say something?
Yeah, I wanted to ask that. So, when you say there was a strong relationship between medicine adherence and social well-being, maybe do you want to explain a little bit, Bichana, so people can understand what that means?
Okay. By medication adherence, that's when one will be taking their medication, but there's a lifestyle besides the medication adherence.
Okay.
So their lifestyle influenced their medication adherence.
Okay.
Be it the way they lived, they be facing stigma, social isolation, and many other different things they'll be facing. So these challenges they'll be facing affect their medication adherence.
Okay.
For example, when they face stigma, let's say one is in school, they are taking their medication, but they fear being judged.
Oh,
being
periods.
involved.
Yeah.
So they had to hide their medication, or at times they won't take their medication on time or effectively.
Because of that.
Yes, because of that.
Yeah.
And emotional isolation, this is whereby one feels like, we're talking of 12 to 19-year-olds, right?
Young.
Maybe one is 15 and they feel like they're the only one going through this. They're the only one taking this medication. They don't even know they were born with it. They didn't choose this life. They feel lonely. They feel like they're the only one going through this. So it eventually affects their medication adherence.
Oh, okay, that makes sense. Yeah. Okay. So what were the results? What did you manage to achieve with your research?
What I managed to achieve was they needed to have some peer groups. When they have peer groups, they'll feel seen, they'll feel heard, they'll meet others like them. Then, for example, like the one I talked about, they'll know that they are not alone. They'll feel normal. Yes. So it's not just them. So that motivates them to take their medication.
That's powerful. What do you think about that, Ms. B?
It is indeed. And I think we need to have more understanding from our professional.
Okay.
So that he can at least explain and give us an understanding of some of the things that we don't understand. Thank you, Netsai, for sharing that.
Very
at least
powerful
we have a
research.
starting point so that we have a group that can help the majority of these.
Yes. We'll be back for more questions. But we want to hear from our expert, Dr Marume. What do you think about the research?
Thank you so much, Netsai, for such a wonderful research. Indeed, it's good to find out that the people who are trying to bridge the gap in the community.
Very good,
and just to take a screenshot of Netsai's research, the age between 12 and 19, and we had a sample size was 84. And if you're going to take a screenshot of that sample size to infer it to the number of people who are living with HIV in that age group, and this is a very critical age because there's also transitioning from primary school to high school. In some of these courses, they go to say someone was being followed up under the parent, and they do so well in their primary school. They're now moving to a boarding school where they're being exposed to many other children. And for me, it just ticked something into my mind. Like I'm asking, like even to those schools where parents are sending their students to who are living with HIV, are the school well trained to support them? Who is there for them? So having to sensitize our community about this, it goes just beyond the national level, but also to the schools where these children are going to, because in boarding school, that's when you have to store things in your trunk. Sometimes you live as a group, and you don't want to isolate anyone because of their HIV status, so you need to live with others, and we need them to be taking their medication, because in terms of HIV, yes, taking medication is key.
Yes.
But also we have actually seen that in the practice or in everything about HIV, psychological support is very key.
Very key.
So I think it's a very good initiative, and those 84, they are a very small number, but they represent a large number of such age group who are struggling.
We're struggling
And
in the
apart
world
from just
everywhere.
school going, this is also the critical stages where they are developing into puberty,
Yes.
Yeah.
where their hormones are growing. They now want to form relationship. This relationship, boyfriend, girlfriend relationships. And imagine they have to disclose their status, and also they have to explain why they take this medication every day. And we still have a large number of people who are still not sensitized or who still lack information
About HIV. That's very true.
So
And you think would it's changed because we're in 2026, so by this time surely, but it's still that way for some reason.
the only way you can do is when you do research, when you go to people, reach out to them and ask them questions. You will be surprised on how people perceive
HIV, yes.
So even we've mentioned that about forming relationships, and they're also growing and transitioning to school. So it's a very critical stage where their hormones are also fighting them. They're also encountering other levels of their life. And also some actually begins to go to university at the age of 18, 19. So there's a lot of transition which is happening to these adolescents. So when you don't address them, when you don't empower them psychologically, it becomes a problem wherever
that's
they
true.
go. So it's very good, and it's a very key to highlight these psychosocial.
Wow, that's very powerful. Thank you so much, Doc, for that. So I also wanted to also check with you, Netsai. In that group, was there a group that they're taking medication but they don't know what they're taking the medication for? Yes. And how did they handle that?
I actually have a practical example of someone who didn't know the reason for the medication. And at some point when she found out, she was frustrated to a point where she left the medication.
Oh, shame.
And it led to a worse situation.
Now we were talking about their viral load even increasing because of... And what do you think about that, Doc, for the adolescents that they've been born with HIV and now they're being told take this medication, they don't know that that's their status?
Thank you so much for such an important question.
Yes.
It's a very good question. Trust me, this brings to a topic about disclosure.
Yes.
So disclosure is a very big topic. Not just a topic for a healthy care professional. And disclosure, it's either between a parent and a child who is taking this medicine. Disclosure can be a boyfriend and a girlfriend. Or a disclosure can be between a husband and a wife. So it's
so
a
many
very huge topic.
like that. Yeah.
So let me just give a highlight since we actually talked about disclosures. So many people would then ask like, Doc, you're saying about disclosure, when should we disclose to our children? When should someone have disclosure? So when it comes to pediatric population, disclosure should start as early as possible. Remember nowadays kids, they can listen to very interesting things like Auntie Rachel. You try to use simplest things to make these young children understand language, right?
Yeah.
So the same with the disclosure in terms of HIV. You start by just mentioning simple things. Like, you know what? There are diseases that someone can have. You can give them different types of diseases, cholera, viral infections. And you know what? Viral infections, sometimes they can weaken your immune system. And other people, they have this virus, which they acquire. Then it goes again to say, how do someone acquire HIV? Whether HIV can be transmitted from mother to child. HIV can be horizontal transmission, where someone grows up with HIV and they can acquire it after they were born without HIV. So this disclosure comes with you mentioning the simplest things, starting from how someone can acquire diseases. And after you've mentioned that, you then start to use simplest things. So what HIV does, other diseases, they weaken the immune system. And your immune system will always attribute it to the army, like these are your army, your soldiers of your body that fight against diseases.
Yes.
So HIV weakens it. So these pills, you're taking them because they are there to destroy the virus so that we preserve your
immune system. Yes.
So disclosure should start as
early as possible,
starting with the least things that you can use for the child to understand, and it can be escalated depending on the understanding of the child, because we don't understand things at the same level. So disclosure is very important. And it also brings the question, who should do disclosure? It's not the health care worker, it's not me as a doctor. No, I can be there to assist and to guide, because adolescents will tend to ask very difficult questions. Trust me, I've heard and sat in a conversation where disclosure was done and the child said blunt to her parents that whoever brought HIV should be taking the medicines, not me. So imagine in such a situation, you're seated there and this heated argument is just brought up. And that's when you now need critical learning. And trust me guys, I've been in a situation where there are appropriate answers to give, but not at that time.
At that time you shout, what can I even say?
Yes. So you end up trying to control the situation, and imagine you've actually mentioned about how someone acquires HIV. You can always go back there and try to make sure you make the child understand, because it's not the parents' fault. Because there was a time where art wasn't widely available as it is right now.
Yeah, that's true.
And by that time, we had many people many children getting HIV from their parents, and also nowadays we now talk of what is called PMTCT, prevention of mother to child transmission, which has actually changed to elimination of mother to child transmission. So we want to eliminate mother to child transmission. And how do we do that? So it means also when you're counseling these adolescents, because they are also moving to being adults who want to form their families. So encourage them that this is the time where you take your medicines, not just for you. For you, it's good to suppress your viral load so that you don't get ill, but also when you want to start a family, not to give it to one of your children.
Exactly. Yeah, so that's a very important key thing. Oh, thank you so much.
There should be a lot that should be taught in the community, like at schools, even in our organizations.
Yes.
I'm realizing that a lot of people don't know much about this, and we need that knowledge so that we have an understanding, not just the person who's not feeling well, but for each and every individual to have that understanding. It helps.
Yeah, disclosure is important.
From a judgmental way of thinking.
That's so true, Ms. B. Absolutely. And what you're saying is very important, because you mentioned something to do with disclosure, and a very important one that you mentioned is between boyfriend and girlfriend, and maybe husband and wife. And I think it's something that it's still happening in our communities, and I'm sure you've come across cases like that. And I think it's important that we emphasize the importance of disclosure. So thank you so much for bringing that up, Doc, and thank you, Ms. B, for that addition. So maybe we can also get more into Netsai. I don't know if you wanted to. Is there anything else that you wanted to tell us about your research? But you did an amazing job here, and it's starting a very important conversation, because it's it's important to talk about these things, because like you're saying, I think there's an important a point that Doc Marume spoke about, that if you go out there and if you actually find out how many people know about this, and you'll be shocked the amount of stigma that is still there. So I don't know, is there anything else that you would like to tell us about your research?
During my research, I was actually curious about the numbers of people living with HIV.
Yes.
When we got these medications, I thought by now the numbers would have reduced.
Yes.
But it seems like they're still coming up in numbers. Why? Because of the disclosure that was being talked by Dr. Marume.
Yes.
People fear to disclose their HIV
status. Yes.
They fear of being judged. So these teenagers to put them in my shoes. I won't be able to tell my boyfriend that I'm HIV positive. If I did, then they would judge me or leave me. Then it would be difficult for them to get married or to marry.
Oh, that's a tough one. Yeah.
You'd find they would stay quiet. Then they'll continue transmitting the HIV. It continues. So our numbers keep on rising.
Yeah, what do you think about that, Doc?
Yeah, thanks for highlighting that key factor about relationship, because these are formal relationship, and it's not about, you can actually have a good boyfriend or a loving girlfriend and who is HIV infected. Either way, it can be either a boyfriend being positive and a girlfriend negative, or vice versa.
True.
So here's the thing, I would want to feel like also we get pressure from external, because when it comes to relationship, even marital issues, it doesn't just involve two people, and that's when other people, they lack knowledge about HIV.
Yes.
But I think this also comes to a very important aspect that I should bring in about HIV management, because let's look at someone who is HIV infected and who is taking their medicine, their ARVs. If they're taking them very well, wherever they are taking them or accessing their care, they are monitored through what is called a viral load. So what does this mean?
Yeah.
It means if you're taking your medicine very well, your ART, which are your ARVs, we should see that HIV should be suppressed in your blood.
Yes.
So how often is this done? Depending on recommendations from the national guidelines. Once a year, someone should at least have a viral load done. And if you're taking a medication well, you should be suppressed. And people will ask, Doc, what is the suppressed viral load? Anyone with a viral load less than 50.
Okay.
That's suppressed.
All right. That's good for our viewers to know.
Yes, that you should know. So if you are to have someone that you want, that you really like, that you really want to have a relationship with, I think that's key to know. You have to know, one, their HIV status. If they are positive, it's not an X to say you're not going to continue the relationship. That's when you should know how they are taking their medicines. And the only way to see this is to look at their viral load. And if the viral load is suppressed, that's good. And I not want to highlight the topic that I want to say, but you should say it undetectable, because when a viral load is suppressed, you say it, you have an undetectable viral load.
Nice.
And this goes to untransmissible. So if undetectable viral load, you can't transmit HIV.
Yes.
So you can still have a relationship, can still have your family with someone who is HIV infected, and without you getting HIV or without them giving HIV to the child.
Okay.
Then someone will ask me, okay, Doc, you have said about suppressed viral load is good, U is close to you. What if my partner comes to me and they have a high viral load, which is a viral load greater than 50 to 1,000? So 50 to 1,000, we classify it as a low level viremia. So you have a low level of virus in your body. And maybe you are not well adherent to your medication, with the things that we always highlight.
Yes.
So is it a no as well? Should I say no to my girlfriend because she's HIV positive and she has a high viral load? No. That's when we now need to impact these psychosocial things to everyone. Ask them why, how are they taking, why do they have a viral load, high viral load? How are they taking the medication?
Okay.
How do they feel about it?
Yes.
So that at least to encourage them. Not to say, yeah, I know that if you're suppressed, that's when I should hang out with you. Then if you're unsuppressed,
I can't, it's
not a no-no. But we need people who then encourage these adolescents.
That's beautiful.
And on top of that, like any other relationships can fail. Whether you guys are HIV negative, both of you, or HIV negative positive, or positive, relationship can fail. But also people need to know how to say things when they are breaking up, because also what breaks people's mind and heart is things that are being said, because we don't want anyone who fails in being associated by whatever their condition they're living in.
That is
Because
true.
HIV is also a chronic infection, chronic disease, like other diseases like
Like
diabetes,
other
hypertension.
diseases, yes,
So you can
that's
say,
true.
I come here, I fail a relationship, or I fail to do a certain task, then you shout at me because I'm hypertensive. So it's something that also needs to be trained when people are now resolving or arguing.
Yeah.
Because in these adolescents, you feel that the situations, how people now try to look at them and how they address them. So for me, the take-home message here is, don't address someone as a disease. Address someone as a human being.
As a
like
human
you.
being.
I think
Right,
that's
so
where
you said.
these psychosocial things come, where we want to address people as people, not as any disease that they are suffering from.
Wow, that's powerful.
Doc, I would also want to ask something. Do we have any supportive groups that are in Zimbabwe so far concerning these issues of HIV? Do we somehow have them where someone can actually go and get that help to have that understanding? This is an eye-opener for me. I thought I knew much, but I'm realizing
We're
that I've learned a lot and we still need to learn.
Learn even more.
Yes, as we go.
Yeah. So thank you so much for that question. Yeah, and I would like to say, if I'm to change things one day, these support groups, we don't want people who are HIV positive only.
Yes.
We want everyone to be on board.
Yes.
Because look at these adolescents. You have your own child who is HIV negative, who is going to bring you a girlfriend who is living with HIV. What are you going to say as a parent? What is going to be your recommendation? So it's key. You have to ask.
Yeah.
You have to ask yourself these questions. What are you going to say to your daughter? How are you going to see your daughter-in-law? Or it can be your son-in-law. How are you going to see them when they are
That
coming to
is
you and they are being
so
disclosed that
powerful.
they are positive? So it's from those talks that people have at the back of their mind that you reach to these people and that can break their heart. Because you listen to stories where all over the radio, people saying, there's this hot topic issue where people write a hot topic, I have my HIV positive boyfriend, he's suppressed doing this, how should I go about it? See, like, people still like information out there. So we have groups that looks after people also living with HIV, like Shantiri. So
Yeah, Jandiri.
it's a very good group, which is actually helping adolescents living with HIV, empower them. So from the word Shantiri, it means
Jandiri.
who I am.
Who I am.
Who I am. So we also need to empower everyone to know who they are. So it's not Zandiri in terms of
Yes,
Zandiri because you are you're HIV. No.
HIV.
It's also Zandiri even whoever you are, you have to know who you are. It's very important. So there are such groups. But I'm saying they might fail to reach to the dead end of the society.
Sure.
Because the society goes beyond these adolescents who is trying to find their ways because they are living with a chronic disease.
Chronic disease, yeah.
So it needs to empower everyone in the society to reach out to everyone, to show love to these people, to show love to everyone so that we stop the spread of HIV. And also, those living with HIV, they have a good quality of life, especially adolescents, because they are also fighting a lot, which will be happening in their life. So
That
they
is
need
so true.
our support, not just from clinicians, not just from Zantiri, not from even PA counselors, even not from the counselors, but also from the community. It's very important.
It's very important. Oh, that's very powerful. Thank you so much for that, Doc. Netsai, do you have any recommendations that you can give regarding the research that you've done and the way forward regarding after you've done your research and what you think you can recommend for the world going forward?
Okay. I think there should be an ongoing assessment of the quality of life of these adolescents.
Okay.
Yes.
Oh, that's powerful. Thank you so much for that. Doc, I think we can also now hear from you as an expert. I know you. Is there anything else that you'd like to let our viewers know about HIV and AIDS beyond just adolescents living with HIV and AIDS?
Yeah, thank you. Let me just highlight to Netsai. Maybe when you were looking at your research, did you encounter like any adolescents where some conditions which they were affecting their quality of life, like maybe something on their skin that will affect them to have rejection in the community. Have you ever come across such?
Yeah, one or two.
So, so it's very important because some will have these lesions that they'll have on their skin, and trust me, it really affects the quality of life. Because if someone is looking at them,
They're self-conscious.
self-conscious, they're asking questions, what is this? So it also breaks them down mentally.
Yeah, that's tough.
So it's very key. And also, trust me, from my clinical practice, to be honest, due to the constraints of the consultation time, remember we have to compete with the doctor, you know? And especially when we access our even in private, even in public facility, you know, even if you go to a private doctor and a doctor seated there with the patient for 1 hour, you start to complain, why is this patient still there?
Why are they taking so long?
We want to
seeing
go,
that?
everyone else is looking at their watches and they want to say this doctor is very late. And sometimes they can threaten you as a doctor, say no, we want them to come back because it takes time. And people come in a rush to access medical care.
Yeah.
Trust me, I've come across many patients who had walked into the consultation room with severe mental breakdown, not because of HIV only, but they'll start to fake symptoms to just come to you because they have mental breakdown or things that are going on in their life. So let me not deviate you more to this topic. Let me highlight key things when it comes to HIV. So we shouldn't be afraid of HIV.
Yes.
And we should prevent the spread of HIV.
Yes.
How do we do so? To make sure, remember that goal that you have achieved in Zimbabwe. I think you highlighted that in your research.
In the research.
That 95% of our population should know their status. And we have achieved that.
Yes.
And of 95% of those that are tested in the population, we have 95% of who know their status were HIV positive. They should be on treatment, and we've achieved that.
Yeah, well
Then,
done to Zimbabwe for that.
Yes. And the last 95 is of those 95% who knows their status were HIV positive or on treatment should be virally suppressed. And that way, if we achieve that, we have achieved undetectable viral load. And undetectable is close to untransmissible.
Yeah.
So that's very key. So why am I saying this? It's to put in awareness that it's always good if you are HIV positive to take your medication very well, so that your quality of life remains good.
Yeah.
For those that do not know their status or that are HIV negative, it's my recommendation every year, just
do an HIV test.
do an HIV test as a routine, as a part of your routine test.
Yes.
Then it also brings a point like, doc, you know, there is this whole noise about HIV prevention. Everyone wants to hear about it. Everyone is excited. And even us as clinicians, we are excited, to be honest.
Yes.
But so I can't walk away from this podcast without mentioning HIV prevention.
Yeah.
So HIV prevention goes into two modalities. We have pre-exposure prophylaxis before pre-exposure, then we have post-exposure prophylaxis. So I'll start with the post-exposure. What does it mean? Maybe, you know, with adolescents or any other adult, any other human being, you go out, you hang out, maybe you're drunk or you go walk up with someone, you have fun, then you have sexual intercourse, and you're worried that I might have contracted HIV, or your partner then later disclosed to you that I'm HIV positive, and you are afraid. You shouldn't be afraid. You should come to any clinic around in Zimbabwe. Go there, they will offer you an HIV test. If you are negative, if it is within 72 hours of that encounter, they can give you post-exposure
prophylaxis.
In this post-exposure prophylaxis, these are the same tablets that we use to treat HIV.
Maybe most people just know it as PEP.
Yes, post-exposure prophylaxis.
Yes.
And it's someone who has been exposed. Then pre-exposure prophylaxis, then you'd want to ask me that who is eligible, because there's an eligibility criteria. So who is eligible for PrEP? The eligibility criteria, it goes to say anyone who perceives themselves to be at risk.
Yes.
If you just perceive yourself to be at risk of acquiring HIV and you are negative, you are eligible for PrEP.
For PrEP, yeah.
Also, we go on to talk of someone, say I've met my partner, we want to have a family, but they have a high viral load, and I'm negative. You are eligible for
Pre-exposure prophylaxis, PrEP.
PrEP. So, what are the modalities which are there for PrEP? So, number one modality, we have an oral tablet that is taken daily, which is a dual combination of antiretroviral therapy, which is Truvada and Tristan. So that tablet, you take it daily as a pre-exposure. So if you start to take it today, it starts to peak its effectiveness within 7 days. That's when we said for males 7, for females about 21 days.
Yeah.
Once you're taking that tablet.
Stuff for women out there.
No, it's to do with their anatomy.
Yeah,
so
yeah,
we
that's
have to
true.
describe that.
Yes.
So that's when it starts to work. So you take it as a daily tablet.
Okay.
We talked about the oral. Then we go to, for females, there's other which is called the depibrine ring, which you insert in your vagina for a month. If you go to Spearhouse, you find out if they still have. It's a monthly vaginal PrEP, which depibrine ring, which they can use.
Okay.
Yes. Then we go and move to another modality, which are injectables, which everyone's,
Everyone is excited about these.
Yes. So these injectables, we had cabotegravir, but I think it has enjoyed its stay. Yeah, because cabotegravir is a very good injectable, which is injectable every 8 weeks. So initially you get your initial dose today, then you have to get another second dose after a month, which is after 4 weeks, then you have to come after 2 months, and this is being injected after every 8 weeks.
Okay.
So that's for cabotegravir. It's an
Nice.
injectable intramuscular injection.
Okay.
Then the bigger one, which is now making a lot of noise.
Yeah.
Yeah, it's lenacapavir. So lenacapavir,
That one has been making a lot of
noise. Yes,
Yeah.
lenacapavir, it's injectable PrEP. We are using it for pre-exposure.
exposure.
Take it right, not for treatment.
Not for treatment.
It's for pre-exposure. So this one you get it every 6 months.
And
You
for
get
everyone
your
else, we
injection.
don't want injections all the time. They're sorted in this.
So
Yeah.
Trust me.
prevention is
Yes.
better than cure.
Yeah.
Prevention is better than cure. So you get your injectables. Today, if it's in January, we'll see you in July.
No.
Nice.
But why have I explained about these modalities about pre-exposure? Because if we have a population that is on art and they are taking their art well, they are undetectable viral load, they don't transmit HIV.
Yes.
And if you go to a facility and you can't find lenacapavir, they have Truvada. Take that Truvada. It can work well for you. It's what pre-exposure prophylaxis. If you're a lady, if there's no cabotegravir or lenacapavir, go for that depibrine ring. Insert it in your vagina. It doesn't irritate. It's okay. You don't have to remove it. After a month, and it just dissolves on its own. You don't have to remove it.
Yeah,
After a
because
month,
people are thinking inserting things and they're like, so it's not painful to
it's
insert.
not painful.
Okay.
And
Alright.
no one will feel it during sexual intercourse.
Nice.
It doesn't change the vaginal pH and everything.
Nice.
It's safe.
Okay.
So I'm saying this because someone will walk in and they say, I want that injectable for 6 months. And the clinic says, we don't have. But they have something. Go
There's
for that
options.
one. These
Yeah.
are options of
Yeah.
treatment.
Yeah.
Then someone also asked me like, Doc, yes, I am now with my partner, and yes, I've been on the medication. When can I stop taking my pre-exposure prophylaxis? So if you perceive yourself that the risk is lowered, let's say I'm HIV positive, and my wife is HIV negative, right? And she's on PrEP because she's feeling that she's at risk, or maybe I have a high viral load. Then I get encouraged. My partner is reminding me to take my medicines very well. I suppress.
Yeah.
I know if you suppress viral load, it goes to you, it goes to you. Then if I'm suppressed,
You can't
no longer transmit HIV to my
and that's the goal.
That's when she can safely stop
taking the PrEP.
The PrEP. But anyone who feels, even if I'm suppressed, and my wife still feels like she's still at risk of getting HIV, she's still eligible for pre-exposure prophylaxis. But then, in addition to that, another question that people would ask me, like, Doc, yes, people are worried about HIV, but it's not HIV that is only sexually transmitted, guys. They are sexually transmitted infections.
Thank you for mentioning those, because it's either people are scared of HIV, but there's other things in between as well, and that can also make you even more accessible to HIV when you have STIs, right?
Yes. So why does it make you susceptible? HIV can only enter someone's body on a breached skin barrier.
Exactly.
So when you have an STI, you remember they causes ulceration, most of them, and those ulcers, they are the entry point for the HIV.
Yes.
So why am I talking about STI? Because there are worse things. Because remember, the most bigger thing that we talk about that people don't know about, HPV, human papillomavirus, is the biggest STI that can be transmitted in people. And you know what it causes? Cervical cancer or penile cancer, or causes genital warts. So those are also sexually transmitted. So you have to make sure that apart from that, even gonorrhea, chlamydia, we can syphilis,
yeah.
Yes. And trust me, those STIs, sometimes they are asymptomatic. Most people walk around with asymptomatic sexually transmitted infection.
And then they're transmitting them, and it keeps going and going.
So, from the modality that you have mentioned, we also have to talk about condom use. Correct and consistent
condom use, yes.
Yes. So that's very good. It is very key. And I know people talk about prevention, but let's not also forget about abstinence. Abstaining from sexual intercourse.
Yes.
And also abstaining from having multiple sexual partners, which you don't know their status.
AKA Mjolo.
So that's very important.
Yeah.
So I think, to conclude, in as much as we know about HIV, we need to encourage our adolescents. As much as we know about HIV prevention, we also don't have to eliminate the issue to do with STIs and also unwanted pregnancy. Because apart from that, because we also have to teach them about pregnancy, planned pregnancy, and also contraception.
Yes.
Because we don't want them to have unwanted pregnancy. So it's a bigger topic that should be introduced to our adolescents as they are growing, and teach them so that they are aware about it's not about HIV only, also having an unwanted pregnancy.
Clearly, we'll have you back for part 2, because you've got a lot to unpack.
Yes,
there'll be a part 2. It's much needed, right, Miss B? Yes, we need more. Yeah. Our viewers need to hear a lot more. Yeah. You can go and talk.
That's fine. So in conclusion, let's encourage our adolescents to take their medication. Let's also not shy away from listen to their social problems, which can have bearing on their treatment.
Nice.
So if you see yourself incompetent to deal with psychosocial things, let's utilize our psychologists and also our psychiatrists, because if you are going to refer anyone to a psychiatrist, they think that they have a mental illness. But also,
it's not always the case.
They need counselling.
Yeah.
And also, let's watch what we say and how we say things, because it also has a bearing to these people that are around us. Let's also prevent transmission either to those who are negative or to our children.
Yes.
Let's also prevent getting STIs, those sexually transmitted infection. Yes, we can be excited about the injectables and everything, but let's also remember that there are other STIs and also hepatitis B. It's also other sexually transmitted infection.
Yes, it is. Yeah.
This one is very
big. Yeah.
It's actually very expensive to manage, and it's actually a killer if it affects your liver.
Yeah, absolutely, Doc.
As I'm concluding, I just want people to know that there are people out there and I'm one of them who is willing to look after anyone, not just in the field of HIV, because like anyone, like any other human being, they need a strong community with strong public health awareness.
Oh, that's amazing. Thank you so much for that, Doc. Thank you. Ms. B, do you have anything that you'd like to add on as we conclude?
For me, this was an eye-opener, and I feel Doc should come back and give us more information, because a lot of people lack knowledge. That's what I've been seeing, whether educated or not educated. This is something that still needs to be addressed there. People to have more information of understanding.
Exactly.
I think that's what I can say on my end.
Oh, thank you so much, Ms. B. Netsai, do you have anything that you'd like to say to our viewers, our adolescents? You did such a powerful research, and we're so proud of you. Anything you'd like to add, tell our viewers, especially the adolescents?
I think much of it has been said by Dr. Marume, but I'll just say stay safe out there.
Yes, absolutely. No, thank you so much for that. Any final words?
Yeah, it's also on staying safe. Like, I think adolescents should be empowered, should feel within them, and not feel guilty about their status. Not feel bad about their parents, because some are vertically transmitted. Even if they are horizontally transmitted, not to feel bad, but also to have a constant dialogue to have this point, like, they talk about ecocentrism, way I'm just viewing things the way I'm viewing them, but also have to view on how others see them, so that at least this dialogue goes on. And also, in conclusion, adolescents suffer also even from caregivers, where they are now, because if someone passes 18, they are now an adult. They can stand on their own, they can do their own decisions. So adolescents these parents for these adolescents should learn in the process of weaning them off, so that they can take responsibility of their medication, they empower them, and always encourage them.
Oh, thank you so much for that, Doc. Netsai and Doc, we are so thankful to have you on this episode. You've unpacked a very important, sensitive but very important issue that I think, like I said, you guys will come back for part 2 for sure, because there's still a lot to unpack. Ms. B, thank you so much for co-hosting with me, and there'll be so many more episodes that we will be together, so I'm so excited for this. So to our viewers, I'm so excited that we managed to talk about a very important issue. And to communities out there, please help our adolescents. It's not an easy disease to live with, but as you heard from our experts, there's so many options, there's so many treatments, there's PrEP, there's PEP, and also there's, speaking of using protection, and also to our adolescents that are living with HIV, you're seen, you're valued, you're appreciated, and we will continue to do as much work as we can as a public health care unit to be able to spread awareness and to be able to come against the stigma that is still there. But I think I really want to commend efforts from our government for doing the work that they're doing in fighting the stigma and helping those that are living with HIV. So I'm so thankful for this episode. Thankful to you viewers for watching. If you have anyone at all who needs support and in the community living with HIV and AIDS, please be there and help and be a part of the movement that is helping people out there that are living with HIV and AIDS. It doesn't have to be just a clinician. Like Dr Marume said, community is very important. So please, let us also spread awareness. And I'm so glad there's so many options out there to prevent HIV as well. So let us go to our healthcare providers, and to our healthcare providers, pharmacists, doctors, and we play a very important role. So let us continue playing the role that we have been doing, and we'll find that very soon we'll get to the goal that we are trying to reach as a country. So thank you so much, viewers. please can you pass this episode on to someone that you think it can help. And if you haven't subscribed already, please subscribe, follow us on our platforms, and thank you so much for tuning in. I just want to say thank you so much to Lewis and Brighton, our production team, for making this episode possible, and thank you to our Institute of Public Health. Thank you so much, viewers. We appreciate you. Thank you for tuning into Health Shenanigans Makua Eltano Ama Hunga Hunga Ngeza Mpila Kahle. From your host, I'll see you on the next one.